Welcome to Certivia's open chat on shared parenting and COVID-19. We are so pleased to have Denise Bayer here to share some time, her personal time with us. She's a licensed mental health counselor here in Florida and been teaching parenting and divorce class since 2003 and writing for Certivia for well over a decade now. She's here to offer some guidelines for managing this crisis. Ms. Bayer, thank you for sharing your time here today.
Well, thank you for having me. I appreciate being here and the opportunity to talk.
The biggest question that we're hearing out in the phone calls of people calling in and through your counseling session is that the most burning question people have right now is, should they talk to their kids about COVID-19?
Absolutely. As parents, we have the responsibility to teach, nurture, reassure, and protect our children. And this crisis, just like any other situation, gives us the opportunity to make sure we provide all those three factors. So we need to teach our children what it's about. We need to make sure that they know what they need to do to protect themselves. We need to reassure them that everything's going to be okay. And because touch is so limited these days, we don't get an opportunity to reach out and hug as many people as we're accustomed to. It's real important that you spend a lot of time nurturing them. They may become more clingy and might even act out with the uncertainty of what's going on. And we can do a huge service to our children by making sure that we are just understanding and there for them. So yes, talk, but only at the level that they can comprehend.
The age level of understanding.
Yes.
The essence of touch, I know that it's very important.
Mm-hmm.
And we can do safe touch within the parameters of our own household.
Correct.
Yes, and so they shouldn't say all of a sudden, don't hug grandpa, this or that, you know.
No.
So we can still, within that parameter where the house there's no case of COVID, touch is still a valuable.
Absolutely. If the virus if we are exposed to the virus, the CDC, the World Health Organization, there are guides right now, and they are telling us what they are learning about the virus. And we know that anytime a person has been exposed, we need to quarantine that person, and we can do that in our own homes. And there's lots of people that are setting up a special space and feeding, making sure that they get their nourishment without contaminating the rest of the household. We want to avoid that, of course, at any opportunity we have, but as long as there are no symptoms, we are being instructed that we are still able to share and be a part of our family.
Very cool. This virus is coming in the middle of people seeking legal support for the relationship that's ending. What should parents do when they live in separate households?
Wow, and this is probably the toughest question of all. Fear is unfortunately driving a lot of the reactions that I am witnessing. I get calls on a daily basis, multiple calls. What should I do? The rule of thumb right now is that we follow the most restrictive orders. And so right now we are encouraged to just utilize essential services and not put ourselves in positions where we're out in the public and potentially exposed. That does not apply to families. Families are an essential service. And we have people who are going through separation and divorce or who have a final judgment of one form or another are expected to follow the order that's in place. And that means sharing your children. We need to do it in a way that makes sense. We need to be respectful of one in each other's space. We need to make sure that both family systems are following the guidelines, again, of the CDC, the World Health Organization, and following whatever those guidelines are for safety, meaning we're washing constantly. We're going to have the cleanest hands in all time. We teach our children, and we need to practice and model that. We are coughing or sneezing into our sleeve. we're keeping our social distance. We're engaging and utilizing the technology that's at our fingertips to make sure that we stay connected. But outside of that, parenting is parenting. And children can easily go back and forth between two homes as long as parents are being transparent.
I know you authored a book called Parenting Plan, and I wonder if we'll be adding another chapter for this type of scenario that we're encountering now.
Absolutely.
But it's that type of planning.
Yes.
Yes.
Yeah, well said. Colleagues of mine and I are talking about how after this experience, there will be clauses to parenting plans that are the pandemic clause. Here in Florida, we have the hurricane clause, but now we're going to have to add such serious problems like pandemics.
So, in regards to this, there's a lot of parents who are separating. What are they doing right? And what are they doing wrong or incorrect?
That's also a very good question, and unfortunately, we have quite a number of both cases. I had a meeting with some parents that I work with this morning, and one parent works in the healthcare industry as a nurse, and is actually on the special unit where individuals who have the virus are being taken care of. And they share a child. And because of her work, they mutually agreed that the child would stay with dad as long as she was working in that unit. And they are doing video chats, and the child is able to video chat with mom multiple times a day. And they're keeping each other apprised of how things are going. That's a positive scenario. And that's not what's required. Children can go back and forth, but in their situation, it felt too compromised. And they weren't willing to take that risk. Other scenarios, there's no issue. And no one's sick, and parents are working from home, and yet they're still arguing, believing that the child should not go back and forth between the two homes. That's not acceptable. There is an expectation that the court's orders are being followed to the best of people's capability and within reason. And so that's what people are doing wrong, not sharing. What people are doing right is being flexible with one another and recognizing that we have to make adjustments. And the biggest thing people can do for each other in this crisis, and this is everybody, this is whether you got kids or not, is be transparent. Hey, I'm a little uncomfortable. I was exposed, I think, to somebody, so we're going to keep our distance, and I'm going to self-quarantine. That's what we should do. I was with a family last night, and we were talking about how awkward it feels to stand 6 feet or so away from, we were using the example of the post office or the convenience store. They've got little markers that tell you where 6 feet is. And wiping things down after people leave, and it feels very uncomfortable because it feels like we're being suspicious of our fellow man, and that doesn't feel okay. But what we're doing, and we have to remind ourselves, what we're doing is protecting ourselves and each other. And as long as we keep doing that, we're going to get successfully through this very difficult time.
I know they're even saying now, it's suggestive, jokingly, but that we're huggers,
yes,
Americans, and we are very close to each other that way. But now they're even saying do a little toe touch. So, it's granted that's a little bit off the chain, but it's gestures are really good. Warm gestures from my heart to your heart. Things like
right.
that we can add some.
Absolutely.
You didn't mention news. Tell me about how that could be, what we're being inundated with is a good thing, or can it be maybe not so good?
Right. I guess I got nothing but story after story. So yesterday, There was a conflict. Some folks that I work with called me because one parent was saying that the child couldn't go to the other parent's house. And so after listening to them, I realized that one particular parent was very receptive to the information that I was able to provide. That parent had not received accurate information. So already today I've mentioned the CDC and the World Health Organization and our public radio and television stations. Those are the places to go for neutral. And what we want to make sure that we do is not listen all day long. This is no different. I mean, no, it's very different, but it reminds me of those of us who are old enough to remember September 11th and how we found ourselves glued to the TVs just watching the horrific scenes over and over and over, and they finally looked at us and said, turn off your TV. This is not a healthy thing for us to be doing. So I think the same thing goes with this. This is such a fearful thing. It's important to look for and have adequate information about what is out there. But after that, it's time to focus on self and self-care and loving and being with our children and getting our work done as best as we can.
I know if the parents are healthy, the kids are healthy. As parents, what can we do to make us healthy so it'll transition or transcend into our children?
Well, the thing that I keep stressing these days is that stress compromises our immune system. We know that children who are living in two homes or have two parents that are having difficulties have an increased number of colds, digestive problems, and headaches. And that is all in relation to the stress response of our body. So what we need to practice for ourselves and ultimately serves as a model for our kids is to engage in healthy activities. We need to get good sleep and eat good food and watch that we're not throwing a lot of junk food down our bodies and get exercise, get out with social distancing, of course, but get out and do things. This is an opportunity for us to really reconnect with people that we have become somewhat distanced from as a result of technology. Okay, well, let's use technology, but let's use it well. And so watching our own stress reaction, to answer your question more succinctly, to watch our own stress reaction will indeed protect our kids from the dangers of the fear that surrounds us right now.
I know us being home longer, we planted a flower garden.
Yes.
During this time.
Yes.
I mean, it's all you hear is death, but you know, it's this. We were planting life, and
That's right.
And we picked the blossoms out, the roses, and put them on the counter. So
That's
it's a
right.
nice. In this challenging time, you can do those type of things that would.
I understand from some of the parents I work with that some of the schools sent the kids home packing with a project of growing plants. So being able, and that's helpful for kids and helpful for ourselves when we're taking care of someone else. It feeds back to us, and that raises our endorphin system to counteract any negative hormones that are being released for stress.
Are any other closing statements you'd like to say regarding to? It's an open-ended question, but what you feel just as the parents, what would you tell them? The shared parenting, what would you say?
I think the most important and valuable lesson is be kind and be generous to one another, because it's too easy to get sucked into this quagmire of fear. And the more we can reach out and just be kind and feel good about what we're doing for ourselves and for each other, will actually counteract any virus that is here. So I think that's the best advice I have.
We're talking about shared parenting. Where could they go to get our audience? Where could they get more on shared parenting?
Oh, terrific. Well, we are offering, because we are managing our space and essential services, we're offering our class live starting next week. So hit the Certivia website, and we have lots of resources for parents who are trying to learn how to share successfully and manage children in two homes.
Very cool. Well, thank you, and be healthy and well.
Thank you.